Everyone, in this video we will discuss about BlockBuster. BlockBuster is an advanced second generation supraglottic airway device. It serves as a dual purpose tool, a reliable ventilation mask and as a conduit for blind endotracheal intubation. Now what are the components of the BlockBuster? It has an airway tube, this one, and it is a curved tube which connects the mask to the breathing circuit. It has a fixed curvature of more than 95 degree. It is designed to follow the oropharyngeal anatomy. This is the mask or the inflatable silicone cuff that sits around the laryngeal inlet. It provides an effective seal for ventilation. This is a 15 mm connector. It connects the device to the anesthesia circuit or the breathing system. This is the inflation line. It is a thin tubing used to inflate the cuff. This is the pilot balloon. This indicates the cuff inflation status and helps assess the cuff pressure. This is the one-way valve. It prevents air leakage from the cuff after inflation. It also has an integrated bite block. This prevents tube occlusion if the patient bites the airway. This is the gastric channel tube or the gastric drainage channel. It allows passage of a gastric tube for decompression and reduces aspiration risk. This is the opening of the gastric channel tube. There is a 30-degree wedge, which is a rising wedge, and the internal ramp which targets the endotracheal tube directly into the BlockBuster. Now this is the endotracheal tube which comes along with the BlockBuster. It is specially designed to pass through the BlockBuster. It is wire reinforced and it has a atraumatic tip that you can see so that it causes no trauma. This is the introducer which is flexible for the introduction of the endotracheal tube. Now what are the sizes of the BlockBuster? The BlockBuster comes in various sizes, 1 to 2.5 for pediatrics with weight of 2 to 30 kg, and the maximum cuff volume ranges from 4 to 14 ml, and the maximum gastric tube size that can pass is 6 to 8 French, and the endotracheal tube that can pass is 3.5 to 5.5 internal diameter. Now 3 is used for small adults with weight of 30 to 50 kg. Maximum cuff volume is 20 ml. Maximum gastric tube size is 10 French and maximum endotracheal tube size is 6.5 mm internal diameter. 4 is for medium adults, 50 to 70 kg, 30 ml, 12 French is the gastric tube and 7.5 is the endotracheal tube. 5 size is for large adults, 70 to 100 kg. Maximum cuff volume is 40, maximum gastric tube is 14 French and maximum endotracheal tube is 8 mm. Now what are the uses of the BlockBuster? It is used routinely for general anesthesia, in difficult airway management, as a rescue airway when mask ventilation or intubation is difficult, and as a conduit for endotracheal intubation. Now what are the contraindications? The absolute contraindication is inability to open the mouth adequately, complete upper airway obstruction. There is a known supraglottic pharyngeal laryngeal pathology which prevents the introduction. Now what are the complications? Complications are sore throat, blood staining of the device, laryngospasm and leak if there is malpositioning. Now how do you clean this device? Immediately rinse with water after use, wash with enzymatic detergent, flush the gastric and the airway channels thoroughly and inspect for any damage or leaks. Now how do you sterilize this? Sterilization, the preferred method is steam autoclaving 120 to 134 degrees Celsius. It can be autoclaved up to 50 autoclavable cycles. Thank you and follow for more anesthesia pearls.